So when we talk about a biobank, a lot of people aren't quite sure what biobanking means, and I think the term conjures up any number of these ideas, but the bottom right hand from your perspective image is what we actually do in biobanking. So our biobank here was formally established in 2012 and it's located here in the building downstairs. It's essentially a collection of biospecimens. For us, that's solid tissues and blood and other fluids. Biobanks are essential because they enable research to move from earlier laboratory models, where we might be looking at human cell lines, into actual examples of human disease that are taken from real patients, which means that ultimately we can move our research from the laboratory, from bench to bedside, to actual patient clinical trials. So the samples that we have here at Hunter Cancer Biobank, we have both internal and external collections. I'll talk about our external collections a little bit in a moment, but as for our internal collections, we have a collection of blood samples and they're drawn from our patients who are having regular blood tests while they're on their cancer journey. So we take an extra vial from those patients at that time and we bank that away for research use. Our biobank also has a number of research services, and I won't go into these too much, but I will explain them a little bit when we move downstairs, and that's that we have equipment to do staining, to stain the tissue so researchers can look at exactly what those cancer markers are or what might be changing in the cancer, and also to be able to create things like a tissue microarray, which allows us to look at lots of different tissue samples all in one slide. One particular patient changed the nature of our biobanking program. She was a patient who had been involved in our program right from the start and unfortunately entered end-stage disease in late 2016. And she began a remarkable legacy. Just some quotes I wanted to share with you. So from one of our donors' daughter, she said, "I want to thank you for all the work you did to ensure that our father's final wish, the donation of his brain, could be fulfilled. I know a lot has to go right for it to happen, and we sincerely appreciate the effort. It meant a lot to him and our family that we were able to help the cause to hopefully find better treatments and, dare I say it, a cure for brain cancer." And that's what's most important to us. And last year was a very big year for brain cancer research for us. Of the 13 grants that were awarded to researchers that collaborated with our biobank, 7 of those had a focus on brain cancer. So we're very, very confident that these samples will be used in the near future and that hopefully we'll be seeing some exciting results come out of those tissue samples. So this is the wonderful team that I get to work with every day. I haven't put contact details up there, but if anybody would like to know more about the biobank, take some questions. Otherwise, please feel free to come up and have a chat outside.